The DDS rate study came about because of ABX21 had the requirement for the state to develop a new rate setting methodology. The process, DDS selected a consultant, Burns and Associates, in summer of 2017. The consultants have done a variety of presentations on how they have done prior rate studies in other states. The consultants have also met with DDS to try and gain an understanding of our system, its complexities, and rate setting processes. So they are starting from a point of understanding the basics of California. The deadline. ABX21 requires a report from DDS based on the recommendations from the consultants by March of 2019. So Burns and Associates must have the report to DDS by the end of 2018 and are hoping to get community feedback before they issue the final report. The process. Burns and Associates uses multiple inputs to devise a recommended rate setting models, such as current rate data, what is the state spending today, current vendor costs. Burns has been working on the vendor survey since December of 2017. Other data points such as wage data from the Bureau of Labor Statistics, rental and housing data, and other sources to try and develop a complete understanding of the economics and rate setting parameters for the state of California. Current vendor costs. Burns & Associates has in all of its past work collected data on a voluntary basis. So this survey is not required, but we are encouraging as many people as possible to fill it out of what vendors are currently expending to provide services, which includes not only expense data, but information related to benefit packages, including vacations, sick, health, medical, dental, retirement, etc. How direct service staff spend their non-program support time, i.e. in trainings, travels, out sick, and vacation times, holidays, etc., as well as identifying any specialized services that we provide. It is done in a single spreadsheet, which looks a little overwhelming. They've developed a single spreadsheet that covers all the service codes being surveyed. If the service code is not on the spreadsheet, it is not included in the data. Vendors who complete the survey will need to fill in the first 5 tabs that apply to everyone. They are the contact information and revenues, it's an overall, DDS specific revenue by service codes, the totals for a year, the administrative staff and allocated time, non-personnel operating costs, and programmatic staff benefit costs. So those 5 spreadsheets apply to everyone, and we'll go through those further as we move along. On the second, there will be 2 or 3 pages that relate to the specific service codes you provide. Each service code has the following tabs. It is identified by service code, staff, and they'll want you to list all the direct service positions and program support positions, their wages, hours paid, overtime hours, annual turnover, training hours, and how they spend their time each day on average. And the second page will be a service code, and it'll be about, it's labeled Other, is about direct service delivery methodology and non-direct service time. So now we're going to look at what the spreadsheets look like. The first one is the tab that has contact info and revenue. It's asking for the agency name, your federal tax ID number, your vendor ID numbers, H, XYZ, P, XYZ, contact name for who is responsible, the title of that person, phone number, email address, and then the basic information address. The light green boxes are all fillable by the provider or whoever is filling out the survey. The dark green boxes autofill from other tabs and or sheets. As you go down to the bottom of that page, you'll see it's going to have the total of all the revenue that DDS has paid out through the regional centers to you, the federal benefit payments if you have any, fundraising and investment income, and then all other agency revenues. This is sort of just a check for them to make sure that the information sort of makes sense. The DDS revenue page, there's multiple sheets that we will go through, list by service code and a detailed description of what they're looking for. So to start off at the top of the page, 094 Creative Arts Program dash behavioral programs, and we'll talk about behavioral medical programs in a bit. Simply say how much revenue did you generate in that service code if you have it. So these pages cover all the service codes that are being surveyed. If your service code is not in here, it is not to be included in the detail level of a DDS revenue. But on the last DDS revenue tab at the bottom, it's all other DDS revenue. So it basically says if the program was not, or your service code was not in the survey above, total it up. These are the service codes are combined. So if you have multiple group homes under service code 905, you would simply add them all together and say the total revenue for service code 905 was X. The administrative staff tab is going to ask you to list staff by position title, not by name, by position title. So it'll be the title, number of employees. So if you have 5 bookkeepers, you may list all 5 on a single line. The total wages paid, the cost of their payroll taxes and benefits, including medical, dental, and others, the percentage of time allocated to DDS admin. So those are the time spent supporting the DDS programs, the percentage of time allocated to fundraising or investments, percentage of time allocated to all other program admin. And then the final column is percentage of time allocated to non-admin tasks. That's really to identify for small organizations, you may have people who are administrators but also do some direct service or program management tasks also. They want to capture those tasks appropriately. So that's a sheet that has multiple rows. You can fill it out. Again, you can group like positions together and simply report them as one. The admin props, program operations, and other page is to get more detailed information about other costs that are not individuals or staff. Things like rents, repairs, office equipment, depreciation. It asks for the total expense, then asks for you to allocate out those costs either as an administrative function, a fundraising investment function, a function of other services, or as it relates directly to program operations. So there's a multiple series of columns that you can put in other program operational costs. The second slide here also talks about some additional costs that include other. If things don't fit in the categories provided, you can provide a description for those and allocate them. The bright green box is total allocation. As you allocate out by percentage, it will total and will stay red until you hit 100%. So it's going to make you sort of force and allocate to 100%. So all expenses are fully allocated. The benefits tab really talks about the overall benefits, fringe benefits for direct care and program operations staff. So they're going to talk about the number of employees you have, number of holidays, is there a waiting period for those, amount of paid time off, vacation, sick, etc., what the health insurance is, and then other factors including, what do you consider for benefits? Are there different periods for that? Do you have waiting periods, etc.? What your state unemployment insurance costs are. It's usually done as a percentage. If you are self-employed, you'll have to come up with an average for that. It asks you to split the staffing between full-time and part-time as you've defined it. So when you go in and deliver, the next series of slides relate to program services. So the sample hourly slide, I picked tailored day services. It's similar. It's job title. Again, you can roll up multiple people into a single job title. The county or regional center, depending on location. If you're in Los Angeles County, they would like it by regional center. If you're in a particular county or where that service is provided, you can do it by county. Whether the person or the positions are employers or contractors, total hours, percentage of hours that was overtime, total wages paid, which then calculates out, you can see it's a dark green box, average hourly wages. They'd also like your estimated annual turnover for that position level and then the staff training hours for the first year and then any subsequent years. After that, they're asking you to allocate how they spend their time. Direct care and supports, supervision of direct care staff, training program development, professional supports, other program operations and duties, other functions. If they supervise staff, they want to know how many they supervise, and of the services that are delivered or supported, what's the allocation? Is it totally in tailored day services, or if someone is split between, say, tailored day services and independent living services, you would put in 50% for tailored day and 50% for other, and then in the independent living, you put the other 50% of actual costs. So you're reporting by your service codes or by the categories there what that looks like. Again, that page can be multiple positions, and you can roll it up, so you do not have to report out individually. Sample hourly. There's a couple of slides that really talks about the productivity and sort of factors that relate to the delivery of service. It's going to ask about the number of individuals who receive services, number of hours of service per week per individual, average number of service encounters per week per staff person. So how often do people see them? Average encounter length. So you're going to provide, what your estimates are, what the staff ratio is, what the staffing pattern looks like for a typical week, and it sort of asks you to take a look at the direct service as well as non-billable services, individual planning meetings, travel time between individuals, record keeping, employer time, time lost to missed appointments, as well as if there are other activities that take someone away from direct service. And basically want to ensure that all of the time is allocated. And then it asks about total miles driven, per staff, per individual, the workers' comp rate for that particular staff or that program, and how they do the on-site supervision. So on the daily staff slide is similar. Again, all the categories, et cetera, are similar. This is simply for a different service code. This one's 505. Again, you're listing title, what county or regional center if you're in an LA County regional center, and all the other things are similar. The sample daily for the other information, is very similar information, but it relates to day program services, so most of them will look very similar, looking for the various things that people are reporting on. Again, it goes through 2 pages to get all the way down to the bottom of that. The last ones we'll talk about are residential. Again, the same basic format for staffing, job title, county, employer, contractor, hours paid, hours overtime, et cetera, across, and how you allocate out that time. It also in residential adds in a slide or a tab for consultants, so you can list out those consultant positions that you are required and or need to have, the county, number of hours provided, total payments, number of people served related to that. In the residential other, there is the ability to report out the homes that you support across multiple counties, if that's the case. And so there's a multiple series of columns that allow for you to have multiple houses. If all of your homes are in one single location, and this is also true for day programs or other services, you may list them all in one column. If you have multiple counties, ideally, and have the time to do it, it would be great to report the data by county so that we can look at, or Burns and Associates can look at cost data across those things. It then asks about capacity, vehicles, and that kind of information. Continues on to the staffing and includes all the household expenses related to residentials, and then finishes up with any other costs that are related to that. So those are the basic spreadsheet tabs that you would look, again, by service codes. There's a couple of definitions that are important. Behavioral programs are programs that incur increased costs due to an adapted program designed to provide services to individuals with challenging behavioral needs which require enhanced monitoring and interventions in order for the individual to fully participate in the program. Examples could be, for that might be BCBA, behavioral analysts, the purchase of specialized durable equipment or supplies, facility costs, large lots, delayed egress systems, etc. So behavioral programs are being defined as ones that are meeting the needs of those with significant behavioral challenges that are different than the typical program in that service code. Medical programs is the same. It's for situations where individuals have significant medical needs and may need support in a different way than the traditional day and or residential services are provided. Maybe increased RNs, LVNs, additional durable medical equipment, medical supplies, additional lifts and specialized facility costs, etc. So if a program fits into that category, again, they'd like that to be reported separately. So we have behavioral, medical, and then other programs. The survey is out and available. We are really encouraging everyone to complete the survey to help us get data and show the state that we need additional rates and support for the services we offer.